Okay. My name is Beth Vogel. I'm the follow-up supervisor at the newborn screening program. And as I mentioned in my email, we're starting to really work on newborn screening timeliness across the state and wanted to work with the midwife population to understand your needs for timeliness, but also for newborn screening as a whole, and especially education needs and specimen collection needs. So I have just a few slides to go through with some information about that. And then we have Melanie from the newborn channel here who will talk about their resources. And then we'll leave some time at the end for questions and concerns and discussion from any of you. Are there any questions right away before I start going through the slides? Okay, I'll go ahead and get started then. So that's my name and contact information. You should all have my email as well from me sending you an email, but you can feel free to email me at any time. This is a little history of newborn screening. So newborn screening has been in place since the 1960s. It started as one condition in 1965, being mandated to screen newborns for PKU. Since then, there are now more than 40 different diseases, and a lot of changes have happened over those years to the newborn screening program. There's a few disorders of those 40 that I'll focus on today for just talking about why there's such a focus on the timing of when newborn screening is happening. So those are galactosemia, congenital adrenal hyperplasia, and then MCAD deficiency. So there is a regulation related to newborn screening. It's 69-1.4. The part that relates to birth attendance is essentially that a specimen needs to be submitted to the testing laboratory from all newborns that are born outside of and not admitted to a responsible institution. So there's a lot more detail in that regulation that I'd be happy to send you the link if you don't have it after the call, but that's the biggest piece of that regulation is that birth attendants are responsible for collecting the newborn screening specimens. Parents or guardians may refuse to have a newborn screen done due to religious reasons. However, the birth attendant would then be responsible for submitting a deferral form to the newborn screening program that's signed by both the birth attendant and the parent. So just a little bit about the importance of newborn screening. Most of the diseases are genetic and rare and do not present symptoms early on in the first immediate period after birth, but can present in the first hours to days. So there's a window that the conditions can be identified and treatment can be started before symptoms are present. So a frequent feedback piece that we hear from parents who call if the baby has an abnormal result is they'll say, you know, my baby looks great. So this, you know, there's a little cute, happy baby up there on the top. There's nothing going on with my baby. Well, that's the idea of newborn screening, is that we want to identify newborns that have the condition before they start to become symptomatic. Identifying them can prevent disability or even death. With the addition of the conditions over the years, it's actually 1 in 300 babies that would screen positive for one of the conditions on the panel, or actually have one of the conditions on the panel. So to go back to those 3 disorders that I mentioned at the beginning, galactosemia is a condition where the newborns have a failure to metabolize milk galactose. So in order to treat that condition, galactose has to be eliminated from the diet. It occurs 1 in 50,000 newborns. The birth rate in New York is 250,000 babies per year. We have several babies identified in the state each year with galactosemia. If it's not treated, it can lead to cataracts, liver cirrhosis, mental retardation, and in worst case scenarios, death. Congenital adrenal hyperplasia is a condition where there's decreased or absent production of certain adrenal hormones. The treatment is an adrenal hormone replacement therapy, which is an oral medication. This is actually a more common condition that occurs 1 in 15,000 newborns. And then thirdly, MCAD deficiency is a disorder of fatty acid oxidation. So a baby who is fasting and has not been fed in several hours with MCAD would not be able to rely on their fat stores and instead would become very ill and can be a cause of sudden death. the treatment is essentially frequent food intake for those newborns and ensuring that they are fed frequently. The incidence is 1 in 15,000 as well. So again, another more common condition. So the importance of timeliness. I'll go through what can happen very quickly with each of these conditions, but just to give you a little backstory, there was a child who had MCAD deficiency in one of the, another state, not in New York, in the country. And unfortunately, that child died from MCAD deficiency while his sample was in progress to the laboratory. So he was not identified and treated. His parents were obviously very upset about this and led a national campaign to work with newborn screening to improve the timing of the whole system. So a lot of federal funding and a lot of efforts by newborn screening programs across the country has been looking at ways we can identify newborns more quickly so that these instances of a baby dying before their sample gets to the laboratory or while their sample is being tested becomes less of an issue. So, really the whole process of from when the sample gets collected to how quickly things happen at the laboratory end is all being looked at by our program and other newborn screening programs. So galactosemia, is one of the conditions that's considered time critical, all three of these conditions. So we actually are supposed to have results for these newborns by the time the baby is 5 days of age. So you can imagine that means the sample has to be collected. We have to receive it at the newborn screening program, and we have to test it and have a result by the time the baby is 5 days old. So that's a very short window for these babies to get that sample in and for us to meet that now national benchmark. For CAH, that it can be a rapid cause of death, and we mentioned MCAD can cause sudden death as well. So the conditions they chose nationally to focus on for being time critical are really important, the most important conditions on the panel for us to get that result by the 5 days. All of the other results, the benchmark is by 7 days of age. So even though it's not as quick, we're still supposed to have all the results out pretty quickly. So this is the recommendation from our program now is for specimens to be collected when the newborn is 24 to 36 hours of age. We are working on getting this into our regulation. Right now it's not in the regulation with this specific timing, but we have a modification to the regulation that's in process that hopefully will get through the process soon, and then this would actually be a regulation. But at this time, this is a recommendation. One little side note of this is that if the baby were to have symptoms of any of the conditions or family history, it would be appropriate to potentially collect the sample before 24 hours. But just know that if that happens, we need to get a second sample after 24 hours to follow up because we can't screen for all of the disorders on a sample collected before 24 hours. So certainly if there were to be a baby that had a family history or that was exhibiting some type of symptom, you can always call the newborn screening program and talk with us about the most appropriate timing of specimen collection. So a little bit about the role of the midwife in this process, educating the family. So there's some resources available. In the last year, we've have a new resource called the Newborn Channel, which I won't talk about in detail because we have Melanie here to talk about that. Prenatal education, so we have a little bit of information that's important for parents to know before the baby's born, just so they're not hearing it for the first time when they have a newborn potentially and are very preoccupied. We do have a brochure that's available in multiple languages. It's on our website. You can also order those brochures. You can order them both on the website, or if you call the main phone number, there's an option to order supplies as well. The form that we have for parents that refuse screening has a spot where basically they're signing and you're signing that they've been fully informed about the screen. So that brochure can be a great tool to go through all of the key pieces of information for them to think about. So then the next piece where a midwife would be involved in this process is collecting the samples. This is an image of what the form looks like. Again, you can order forms. Just be aware that they do expire, so pay attention to that use-by date if you were to order a bunch ahead. And we're asking for as much information as possible. I will say the most important for us is the date you collected the sample and the baby's gestational age and birth weight. Some of the testing and the cutoffs that we use for the testing are dependent on the baby's birth weight or gestational age. So having that information is really critical for us. And you may have noticed in the past that if that's not on there, we will call and ask for it. So collecting the specimen, here's just a few tips for you. We do have a training video on our website that goes through this process in more detail, but just a few pieces of information that may be helpful. So warming the baby's heel for 3 to 5 minutes and elevating the baby's head so the heart is above the feet can really help reduce unsuitable specimens and increase the blood flow. You want to puncture the heel on the plantar surface, so toward the side of the heel where there's the hatch mark here is the best place to use that lancet to puncture the baby's heel. And you want to apply pressure but not actually milk the heel. That can cause unsuitable specimens. And then fully fill in the circles. So we have an image on the bottom right here of what a valid specimen looks like. I will say it's not uncommon that if blood flow slows, you may need to re-puncture the heel a second time in order to fully fill all 5 circles. So just be aware of that as a not uncommon occurrence. These are some images of what some unsuitable specimens look like. So the first specimen is a QNS specimen. As you can see, the circles aren't fully filled in. There wouldn't be enough blood in this case for us to do the testing. Another important thing to think about is that the blood has to fully soak through the other side of the card. What happens is we take a punch of blood from those circles, and so a small little piece with a punching machine takes a little tiny bit and puts that through the machine. We assume there's a certain amount of blood in that punch that we get, and so if it doesn't soak all the way through, we can't use that sample knowing that there's not as much blood as there should be in that punch, and we could miss a baby that has an elevation of something that we're looking for. So this is a contaminated sample. We can't tell what it was contaminated with. Sometimes lotion and the collector is a problem. This is a sample with serum rings. So you can see around the edges of the sample where there's the lighter appearance. That can be from either milking the baby's heel or rubbing alcohol not being fully dried before the sample is collected. This is a super saturated sample. So what this person may have done is put some blood on and then gone back and said, oh, I didn't get enough, and maybe it looked like this quantity not sufficient sample, so they put on some more. So that doesn't work either, unfortunately. You can't, if you collect one that looks like this and then you're done, you can't go put more blood on top of that. And then this is a sample that was closed up and mailed before it had a chance to dry, so a wet specimen, which I don't think people always realize that if you collect the sample and you don't let it dry and you put it in the envelope, it gets to us and they're still wet. So we can't use that sample. It needs to be allowed to dry for 3 hours before you package it up and send it to us. So finally then, sending in the samples. Regular mail can be a big cause of delay. I can tell you it takes often, we looked at how long it takes samples to get to us in regular mail from when they were collected. It's often 5 days from when the sample was collected. You know, our goal is to have the newborn's result reported by the time the baby is 5 days. So if we don't have sample that long to get to us, then we're already starting out behind that point in time. Hospitals across the state have had access to a courier service through UPS to ship specimens to us, and we realized that we hadn't made that service available to midwives, but that may be really helpful in getting the samples from babies that are born outside of hospitals to us more quickly. So the option is now available for midwives to sign up for our UPS courier service. Oh, seems like somebody has us on hold.
Thank you for calling Jamaica Hospital Medical Center. home of a wide range of outpatient services for the entire family, including our on-site ambulatory care center and our network of Med-Assist family care centers, conveniently located in your neighborhood. Our expert team of doctors and nurses can take care of all your family's healthcare needs. To schedule an appointment in our ambulatory care center, please call 718-206-7001.
Thank you for calling Jamaica Hospital Medical Center, where we now offer a free, innovative approach to treat patients at risk of developing diabetes. The hospital's diabetes prevention.
Okay, that worked. Sorry, I had to mute everybody, but I will unmute everybody when we get through and are ready for some discussion. So I apologize for that little side there. So UPS, you can use our UPS courier service at no charge. We have a person, Deborah Rodriguez, who's on the phone today. Debbie works very closely with UPS. She can help you get set up for an account. There's her email and her phone number. I will send you a little registration form that you could fill out and send to Debbie after the call if you're interested in signing up for that, and then Debbie would get your account started and talk with you. Essentially, you would have to get specimens to a UPS drop-off site, or Debbie can talk to you about options to have them come each day and see if you have any specimens. And then the cost for the shipping and for the pickup would be directly billed to the newborn screening program versus you being responsible for that cost. Okay, so now I'm going to turn over to Melanie, who's going to talk a little bit about the newborn channel. So Melanie, you now have control of the keyboard and mouse. See if you should be able to click through and use your down arrows to move the slides. Oh, you're muted, I'm sorry. Hang on one second. Okay, you're unmuted, Melanie. Sorry about that. Go ahead.
Now you can hear me? Okay.
Yeah.
Okay, thanks, Beth, and I appreciate everybody taking the time to listen in on this little bit of information on some education resources that you have available. I worked with Beth last year to get this in place, and so I just want to quickly go through some of the different video education that you have access to currently to provide for the new parents that are giving birth at home. So we do have, let me see if I can click through here. There we go. Oh, it's going to go. Okay. So I work for a company called the Wellness Network, and we have comprehensive video education for healthcare facilities all across the country. And we're focusing here specifically on our newborn channel library, which is our perinatal education. So we support and educate new parents in the prenatal, delivery, and postpartum stages of pregnancy. So these are some of the different video topics that you'll have access to that you can provide to the new parents that you're working with. So we do focus a lot on breastfeeding. There's some infant and new mom care, the newborn screening process. There's 2 videos specific to the details on specimen collection and the process, as well as the screening for CCHD, the critical congenital heart disease. There's also information on skin to skin, the different stages of labor, and the emphasis of going the full 40 for those new moms, and non-pharmacological pain management and some other things that you'll see. And we do have the New York mandated shaken baby syndrome and safe sleep programming. So there's 2 programs that are mandated by New York that new parents are required to watch. So those are included in this online video library, and I'll show you how to access that shortly as well. All of this programming is evidence-based, and it complies with all of the AAP and ACOG guidelines for prenatal care, and it is accessible anytime, anywhere for the parents. So as long as they have the login information that you can provide for them, they are able to log in using any internet-ready device to view these programs. So that includes a smartphone or a tablet or a home PC. Anything that can access the internet is able to view these programs. Oh, and this cut off a little bit, so I apologize for that. But the website for access is newbornchannelnow.com, and On the materials that we provide you with, you will have a 5-digit passcode specific for the state of New York. So that is 41958. And you would just enter that 5-digit passcode in that line there and click submit, and you would be entered into the library. And I can give you a quick preview of what that looks. I'm not sure if I'll be able to show you, actually. I don't think I can share my screen exactly. But you're welcome to log in and view that on your own. You can go in anytime with that passcode at that website. And these are some of the different tools and materials that we would be providing for you that would allow you to promote this to the parents while you're visiting with them. So we do have what's called Preparing for Baby, which is our prenatal checklist of programs that is divided out by trimester. So we have different programs that are recommended throughout the pregnancy process for those parents. And that information, the login information for the website is also printed on this piece. And it will also be printed on the program library and checklist. So that is a comprehensive list of all of the different programs that are featured within this online video library for you. And we did just, as a company, acquired Milner Fenwick, which is another patient education video company. They have a lot of amazing content as well. And they are contributing to our maternity and newborn care library at a great level. So we have a lot of different content that's coming to you, specifically focusing on advantages of going full term, a lot of new breastfeeding content. There's a lot of information on gestational diabetes that's going to be put in there, and some different approaches to different positions for breastfeeding, a lot of postpartum care information as well. So a lot of good content is going to be coming into this library to complement what's already there for you. You will also see a screenshot of what the online video library looks like kind of there on the right-hand side. So everything is typically sorted by category, and you're able to click on those categories to pull down the video titles that will be featured under those specific categories of content there. And we also have bookmarks, which are a great piece to pass out to the new parents so that they have the online video library information to log in and view as well. And the program checklist is a great tool for the midwives to use because it also has, specific for your login information, your checklist has the newborn screening programs bolded on the list and checked off. So those are automatic recommendations for your parents there. And if they're focusing on something specific while you're visiting with them, you can check off other additional programs that you feel would be important for them to watch as well. And just a little bit of information on how to best utilize this resource that you have at your disposal. Again, distributing those bookmarks and those program checklists to the expectant parents, the new parents, and even their families as well. We know that a lot has changed over the years with some of the newborn safety guidelines, and grandma may have a different view on safe sleep compared to a new mom. And that is good information to share with the entire family so that everybody is up to speed on current guidelines, because we know that it takes a village sometimes, so there's a lot of different people that are influencing your baby's life. So they can all have that login information to revisit and view those topics and view those videos anytime. And again, you can recommend the newborn screening specific content. This will complement your one-on-one information sharing that you're doing with the new parents. And talking about that process for improving the timeliness of the specimen and everything else. If you can have them watch this video, they're already going to understand this process, or maybe they'll be able to revisit this process and get a better understanding of what they need to do and why it's important. And we are trying to identify a process for ongoing awareness with all of the midwives, so we hope to work on some different quarterly mailings with these new materials and get all of the materials distributed. So that each midwife has materials to distribute to the new parents on visits. And we also have line of sight to the number of logins as well, so we can see which programs are being watched most often and which ones are not as well. And that was kind of all of the basic information that I wanted to touch on. So Beth, if you want to take it back, or if anyone has questions about the content specifically, I'm happy to answer those as well.
Great, thank you so much, Melanie. Yeah, we wanted to leave some time for discussion and questions, and we'd love to hear any feedback. So I will unmute everybody in just a minute. Just a few last things for updates. We do have a survey that will be completely confidential to help us understand your needs that will be going out soon. So watch for that in your email. We were lucky enough to have an intern from the School of Public Health working with us for the summer, and she's put together a great survey, and it's really, her goal is to help develop materials that will be helpful for all of you. So just keep your eye out for that. And then, Melanie mentioned something we didn't talk about today, which is the point of care screening. That's done through a different part of the health department, the hearing and the congenital heart disease screening. But if there was interest from this group, we could work with our colleagues in that part of the health department and talk with them about potentially having another webinar where they lead to talk about what the recommendations are for those. So bear with me for just a minute and I will unmute. Okay, so hopefully everybody can now talk. Right off the bat, after you've heard both presentations, are there any questions? You can also, if you didn't want to talk, there's a chat box. You can feel free to type things in the chat box as well.
Hello, I have a question. Can you hear me?
Hello, I have a question. Yeah.
Can you hear me?
Yeah.
Can you hear me?
I'm sorry. It sounds like we have a bad connection. I don't know if you want to try and call back in or if you want to put it in the, okay, yep, you said still type, okay. So we have a question about the deferral form. What I can do, that is on our website, but I can also email it to everybody after today's call. So I will send that out to everybody. And then what you would do is just either you can fax, mail that in to us, whatever is easier for you. I know it looks like maybe some people are working on typing questions. Anybody else have any questions in the meantime? Okay. So we have a question about the UPS envelope. So we did send out UPS envelopes that are specific to the newborn screening program a while ago. But you're right, there were not instructions about how to actually ship them to us. So you actually have to sign up for an account with us to use our UPS account, if that makes sense. So Debbie Rodriguez, who is here on the call, and I'll send out her phone number and email after the fact, can facilitate that. We also just have a little form that you can fill in with your information and send back to us as well to get that process started. It's just your simple name, address, contact information to get that process started. So I will follow up with that, and like I said, that will allow you to send those in at no charge. So I apologize that was confusing. In the beginning, when we sent out the envelopes, we hadn't started offering the accounts to midwives yet. We were just encouraging midwives to use an overnight shipping service, but more recently, we worked with UPS to get a way that we can actually set up accounts for individuals to bill our accounts. So in the past, it was very hospital-based, but we've figured out a process with them where we can set up accounts for individual midwives. So that I can see how that was confusing that you got the envelopes without that, though. So we will get that going. Okay. So there was a question about adequate hydration at 24 to 36 hours to be able to obtain a specimen. The hospitals have been following that guideline for a while, and across the country, the 24 to 36 hours has been followed, and we haven't heard feedback about baby's not being adequately hydrated to collect that sample. I guess if I know that there are certain points when maybe you would go back and visit a family. I don't know, even if you could get it by 48 hours, if the 36 is really a concern, then that would really help improve things. Really the closer to that guideline that you can collect it, the better. If you start to have issues with not being able to get good samples, and by collecting them earlier, definitely let us know. We want that feedback because this, is happening across the country. So if the guidelines being made without getting feedback that there are issues, we won't be able to improve. Okay, so it looks like samples will be obtained at day 2 or 3 and sent out via UPS the next day. Yeah, so I think if you're getting it by that 48-hour mark and then we receive it, really if we receive it by day 3, we can usually meet that 5-day recommendation for getting emergency results out. So I expected that the 24 to 36 window to maybe be an issue, but at least right now that's a recommendation. It may be, like I said, we're working on trying to align our regulation for New York newborn screening with the national recommendation, but as of right now, that's a recommendation only. And really the purpose of it is that goal of getting the time critical results out by 5 days of life. So we're trying to look at how long each piece of the process takes, and usually if it's a Monday through Friday that we receive a sample, that might be something to think about too, because we are at this time not testing on the weekends. So if we get a sample, early in the week, during Monday, if we receive it Monday through Friday, we'll have results out for the time critical. It's usually the same day we get the sample. If the timing would work out where a baby sample might be received by the lab on the weekend, it might be better if you can collect it earlier and get it to us on, let's say, a Thursday to do that. Right. Any other questions? Okay, just a question for all of you that we would be happy to continue putting some webinars together, or even inviting other speakers that are experts in a certain area to talk about issues related to newborn screening. Is there anything specific that you would be interested in hearing about, like point of care, or something more details about specimen collection? If you either want to put those in the chat box, or if you want to reach out to me after the fact, we're happy to continue having these webinars, every couple of months or however often they're needed to address questions or issues. Okay, so there's a question about receiving results, that they used to receive results in the mail and now I don't. We do mail test results out, so you should be getting those in the mail. We do have an online portal to view the test results. It's through the health commerce system, but if you submit the sample, you should get a result back in the mail as well. So I can follow up with you individually on that, and then if you are interested in the online portal, just let us know. You have to have a health commerce system account, and then we can give you access to the newborn screening portal where you can pull up and view the test results. But I'll also try and figure out what's happening there, that they're not coming in the mail anymore. Okay, so some people are getting them in the mail. Okay, well, we'll try and straighten that out. Okay. If a baby does need another sample, or if it was unsuitable, our policy right now is to call you the day, it ends up being the day after we receive the sample, to let you know that we need another sample. You'll also get then a letter in the mail notifying you. The parents will get a letter asking them who the baby's doctor is as well, if they, so that we can notify the baby's doctor as well if the baby's being followed by a pediatrician or a family practice doctor. Any other questions or concerns before? Okay. So I guess if you can, it seems like you're using the chat, which isn't really perfect. Just type in the chat whether having additional webinars is something that you're looking for, or if this met your needs and questions related to newborn screening. So you can just say yes, more webinars, or no, this was good, would be great for us. Okay, more would be good. Okay, well, I think the point of care is something we haven't done much with because that's a different part of the health department, but we can talk with our colleagues and maybe have one on hearing screening and CCH, congenital heart disease screening as well. The heart disease screening is the newer one that's come online that every baby is supposed to be screened for heart disease at birth. So we'll work with them and then continue sending out info. If you have any questions, you can feel free to email me or additional topics. One thing that we could do is delve more into the unsuitable specimen topic if that's an issue for people, and look at some more specimens so that hopefully to help you all identify if a sample would be unsuitable. Okay. Well, not seeing any other questions or comments in the chat box. I'll give it another minute, one last minute for people if they have anything to say or in the chat box, and then we'll end it for today, and then I'll follow up. I will send you Debbie Rodriguez information for the UPS contact information, the deferral form that's on our website, and the slides from today as well. If you need any materials, we did mail out materials about the newborn channel. If you need any more materials, or if you didn't get them before, you can let me know and we can mail you materials as well. Okay, well, thank you so much, everyone. Thank you, Melanie, for the update on the newborn channel, and I will be in touch via email.
You're welcome. Thank you for having me.
Thank you. Thanks all.